Hey everyone, thanks for coming. This is the SOVA workshop. So if that's what you're looking for, you've come into the right room. Um, you know, it's been, I think one of the first things I did as executive director was suggest to Skip that SOVA should be a national project. And I'm really proud to say that in the last board meeting that the board of directors did approve SOVA. It is our newest actual national project. In a lot of ways, we've always been treating it like such, but I think now it'll have the credibility and the attention and the priority that it deserves in the organization. I've always thought it was a great project. It's really is a shame that out of all the veterans organizations that exist in this country, it was described as a sea of goodwill at one point, because there's just so many veteran nonprofits. Uh, we really are the only one that has taken a stand to stop the privatization of our VA. And, it's a shame that this has kind of become a political football, but it really is an amazing example of public health care. We deserve a better VA, and we want to work to continue to fund it and to improve it. But we also have to save it. And right now it is in severe jeopardy. And I think it's a vital program. I think it's a gateway for a lot of new members to come into the organization, to learn about what VFP is all about and have the opportunity to become more radicalized and learn more and become more woke about these issues. So I think it's a really cool program. I think it's a great national project, and I'm proud of it. And recently we've had a new steering committee come together for SOVA, and I think now it has a group of leaders that will hold each other accountable and are accountable to members, a way that can be accessible for folks to plug into the campaign and to become a leader in it. And I'm excited what this year will bring and next year, and I'm excited for this panel. So please enjoy, learn something, and I will turn it over to Bruce. Bruce, go ahead, brother.
Am I visible?
You are.
Hello, good afternoon. My name is Bruce Carruthers. I'm a member of the SOVA Steering Committee. I'm a Vietnam veteran, retired VA employee, and a member of Chapter 99 in Asheville, North Carolina. So what I want to do first is introduce the members who will be on the panel, then say a little bit about the other members on the steering committee, and talk about the question and answer period. So we will have on today's panel, presenting first, Suzanne Gordon, who many of you know, I'm sure. She's the author of Wounds of War and the Battle for Veterans Healthcare. She's an award-winning reporter and author on American healthcare system. She's also a policy advisor to the Veterans Healthcare Policy Institute. She will be speaking on the role of the VA and the overall U.S. healthcare system, and on issues affecting women's veterans. Following her will be ESSAM, who is chair of the Education and Media Committee of our SOVA committee. ESSAM is an Iraq veteran. He's a member of Chapter 34 in New York, and he'll be speaking on legislation, positive and negative, that affects the VA healthcare system. Following ESSAM will be Hugh Foy. Dr. Foy is a professor emeritus of surgery at the University of Washington School of Medicine. He serves as an attending surgeon in general burn and surgical care at Harborview Medical Center, Seattle, for 28 years, from 1991 to 2019. His surgical career encompassed all phases of trauma and general surgery, with an emphasis on GI surgery, abdominal restruction, soft tissue infection, and critical care. His other academic efforts are focused on medical and surgical education. Dr. Foy served as the University of Washington General Surgery Residency Program Director for 9 years, and he was a founding head of one of UW School of Medicine's colleges, where he enjoyed teaching medical students for 16 years. He's also a founding member and former member of the board of the Western Washington's Physicians for a National Healthcare Program. Dr. Foy will speak on the VA as a model for broader healthcare reform and a national single payer system. Last will be Jeff Roy, who's the coordinator of our SOVA steering committee. Jeff is a Vietnam veteran. He's a member of Chapter 27 in Minneapolis. And Jeff will be speaking on the efforts of the Outreach Committee, which is part of the SOVA committee. Not on screen today, but other members of our steering committee are Arliss Harem, who's the chair of the lobbying committee. Arliss is a Vietnam veteran and also a member of the VFB chapter in Minneapolis. Mark Foreman is the chair of the outreach committee. Mark is a Vietnam veteran, a former member of the VFB board of directors, and he's a member of chapter 102 in Milwaukee. And then finally, Bob Suberi, who's a member of the outreach committee. Bob is a Vietnam veteran. He lives in St. Louis, and he's a lifetime VFB member. Following the presentations by the panelists, we'll have a question and answer period. So if you want to ask questions, don't use the chat function, use the Q&A function. I'll review those as the presentation goes on. And we'll try to ask a range of questions, and if there are questions that are similar, I'll try to consolidate those. If you're comfortable, please give your name and your chapter location. So for me, I would say, this is Bruce from Asheville. If you're not comfortable giving that information, certainly you can ask the questions anonymously, and I'll try to give those at the end of the presentation. We'll have time for a question and answer period. So without further ado, we'll have Suzanne Gordon, who is the first presenter, give her presentation. Thank you.
Am I on?
I can hear you, so I think you are.
Can you see me?
I can see you.
Oh, okay. I can't see myself, so it's weird. So I'm really happy to be invited to speak at this conference. I've been to the past, I think it is two or three VFP conferences, and I'm an associate member. I'm a journalist. I wrote a book called Wounds of War, How the VA Delivers Health, Healing, and Hope to the Nation's Veterans, as well as a book called The Battle for Veterans Healthcare, Dispatches from the Front Lines of Policymaking and Patient Care. And I'm delighted to be serving on the steering committee of the SOVA campaign. And I'm a senior policy analyst for the Veterans Healthcare Policy Institute. I've been studying the VA for about 10 years, and I've been researching and writing about the American healthcare system for 35 years. And I want to just talk to you about why the VA is so important and why we have this campaign. The VA is important not only to all veterans, but to all Americans. It gives better clinical outcomes with shorter wait times and at lower cost than most private sector providers on a range of outcomes, from mental health care to cancer care. It's the only publicly funded, genuinely integrated, coordinated healthcare that is delivered across the United States. Not only can you get care if you live in Peoria and then go to Pittsburgh and get your health record and so forth, but care is integrated at every level. It's the only healthcare system that has the integration of primary and mental health care. And it's the only healthcare system that deals with what we call social determinants of health, like homelessness, legal problems, employment problems, and so forth. And not to mention palliative and end-of-life care. It teaches 70% of American physicians in training, many other psychologists, nurses, physical therapists, etc. The American healthcare educational professional teaching system would collapse if the VA was reduced or disappeared. And it's also the biggest research powerhouse in the country. I always thank the VA for my shingles vaccine. I thank the VA. I would thank the VA if I was a smoker and needed to use the nicotine patch or needed a cardiac implantable device. It has better nursing home care than the private sector. It is really a gem in America, which is precisely why people like the Koch brothers, now brother, Concerned Veterans for America group, and Republicans in the hospital industry want to privatize it and get rid of and get their hands on the 80 billion or more that the VA budget encompasses. And I'm not going to talk about the ways in which the VA has been threatened. I mean, I'll allude to the Mission Act, which has outsourced more and more care to the private sector. Something the outsourcing has stopped because of COVID-19. ESSAM ATTIA is going to talk about the really bipartisan legislative agenda. Sadly, many Democrats are participating in efforts to outsource more and more VA care to the private sector, whether it be clinical care, research, the compensation and pen reviews that are done by the Veterans Benefit Administration. What I want to talk about is how the VA is a model of care for all veterans, for people of color, and for women veterans especially. The VA has 4 missions: delivering clinical care to veterans, teaching, research, and its 4th mission, which many people never knew about and recently just found out about under the COVID crisis. And the 4th mission is to serve as the backup for the civilian sector system into the COVID crisis. We see when we compare the VA to the private sector how important it is to have a national system which is mission rather than profit driven when you have a national emergency. Let me just outline some of the facts. The VA immediately is almost, way earlier than other private sector healthcare systems, immediately canceled elective and surgeries and procedures to protect veterans, patients, and staff. This was way before the private sector because it's canceling elective procedures when you have a global budget is revenue neutral. The VA is not a fee-for-service system. Providers are not paid fee-for-service, they're on salary. So if a knee replacement operation is canceled, or if other procedures and treatments are canceled or delayed, it is a revenue neutral. It doesn't hurt them. As one chief of staff of a VA facility, large VA medical center, told me, I feel lucky because we could cancel these things while across the street, private sector systems were jeopardizing patients and staff by continuing, even though they knew that there was a pandemic on. The VA immediately mobilized its leadership in global telehealth to revert to virtual appointments in everything from dermatology to mental health. And they have that capacity, and this didn't hurt veterans of lower incomes because the VA provides people with laptops and devices and iPads and so forth, so they can do this from their own home. The VA shifted staff from, a surgeon from doing knee replacements to doing COVID testing, which it could do because, again, people are employees in the private sector. 50% of physicians are private contractors, and so you can't tell them you have to do this now. Staff were shifted to medical centers in need. The VA mobilized immediately on March 20th, sent out a notification across the nation to its community living centers, i.e. nursing homes, shutting down nursing homes to visitors, protecting staff, shifting to private rooms, making sure food service workers and other workers didn't come in and out of facilities. And as a result, the terrible toll in private sector nursing homes we haven't seen in the VA. In fact, in moving to its fourth mission, the VA has been sending people into private sector nursing homes all over the country, North Carolina, Arizona, et cetera. I mean, there's a whole long list. The VA also immediately set up ICU units for COVID that could accommodate non-veterans, and they helped take care of non-civilian sector patients when hospitals were overwhelmed in New Jersey, Louisiana, Arizona, New York City, et cetera. The VA shared supplies and information, even though it was hampered by FEMA, which deliberately tried to deprive the VA system of personal protective equipment. It's an extraordinary story. And no workers were furloughed inside the VA, unlike in the private sector where hospitals are furloughing workers, critical workers like nurses, doctors, janitors, whatever, housekeepers. The VA, in fact, has finally ramped up hiring and hired 24,000 people. I mean, they immediately did this. I could go on and on about the VA superior care in an emergency. Let me just give you one extraordinary example. In Texas, COVID-19, and this has just appeared on our VHPI website, which I suggest that all of you look at. It's veteranspolicy.org. In Texas, COVID-19 has pushed some hospitals to the limits. And many hospitals one hospital formed an ethics committee to help decide which patients would receive life-saving care while others would be giving only end-of-life care. The VA stepped in under its fourth mission authority and provided care to critical patients. I mean, the VA, basically these patients were being, put in front of a firing squad because of the situation in the private sector, and the VA came in and rescued them. The VA, I believe, is a model for the nation on how you should deliver care. It's also a model on how you deliver women's health care to veterans. Now, many women are very concerned about the VA, and the VA can obviously do better and should do better. But the VA has been extraordinary in the care it delivers to women veterans. Women veterans comprise now 7% of the VA's patient population. That's a tiny sliver of their patients. And yet for this 7%, the VA has set up a separate system of women's healthcare with women's healthcare specialists in every medical center and CBOP. It has set up, I mean, I can't go into all the ways that women's healthcare has been constructed in the VA, but the VA provides high quality, cultural competent care to women veterans. This is from, I'm quoting from Kayla Williams, who was, before the Trump administration caused her ouster. She was the director. She's an Iraq veteran. She was the head of the Center for Women Veterans in the VA. And this is from Kayla. VA has the highest rates of breast and cervical cancer screenings of any healthcare system in the country. Its providers, although most providers in the private sector don't even know what sexual trauma is, much less know the kinds of treatments that are evidence-based for it, the VA understands women's specific military experiences and risks and is able to give women veterans the support and services they need at lower cost. Women who believe the private sector will address their specific women veterans' needs, I think are tragically mistaken. At the highest estimates, women veterans make up 0.35% of patients in the private sector, at the lowest 0.07%. There is no healthcare system will take the time to understand the problems of a group comprising either 0.35 or 0.07% of its patients. So I believe the VA has to improve and is trying to improve on the delivery of women's health care. But the only way that it will continue to be improve, as we have shown with Agent Orange, with PTSD, with other problems, burn pits, Gulf War syndrome is if veterans push it to do that and use the VA and push it to deliver high quality care. And I just want to point out one other thing that's really critical. The VA serves people of color much more effectively than the private sector. And preliminary data has shown that in the COVID crisis, while we know that Black and brown people have died more, way more in the private sector under COVID, there is no disparity in fatalities in the VA system. And that's because the VA delivers better primary care, better management of chronic conditions, and coordinated care. There are really, in my view, and one other thing, our group, SOVA, is dedicated to not only stopping privatization, but to strengthening and improving the VA. We need a robust and expanded VA, not only to take care of current veteran users of the system, but also now under COVID, the veteran unemployment rate has increased to 12% of the, I mean, that's what we know now, and maybe it's even higher, of the 30 million people who are unemployed. So many veterans will have lost their jobs under COVID. They've lost their incomes, and that means that they will now be eligible and probably seek VA care. So we need an expanded VA to accommodate these veterans. We need an expanded VA to deal with all kinds of crises that the Pentagon produces, not the least of which is military sexual trauma, for which the VA often gets blamed, while the real problem is the kind of misogyny, sexual assaults and harassment that are tolerated and I would say enabled in the military. There are also many other conditions that are clearly acquired or exacerbated by military service, and the VA is often blamed for those problems when they're trying to deal with those problems. In my view, and I know ESSAM will talk more about this, and we can talk more about this in the question period, the only answer to the endless attempts to privatize the VA is to expand VA services and benefits to all veterans, regardless of discharge status. Right now, we know that over 500,000 veterans are being penalized because they have mental health conditions or other conditions that lead to the kind of behaviors that encourage the military to discharge them, and then they are given these punishing discharges like other than honorable, that deprive them of VHA services, Veterans Health Administration services and benefits. Other other service members are penalized because of mental health problems by being discharged with a general discharge, which gives them VA benefits, but not the GI Bill. So the good news is, if you've had struggling with PTSD or MST for years and the VA helps put you back together, you can't get educational benefits, and therefore you're stuck in a low-end job, which makes you financially unstable and more at risk for mental health problems and suicide. The issue of discharge status is a particular concern to women veterans, because the military is consistently using penalizing these punishing discharges to punish women who report sexual assaults. And so we need to expand VA to all veterans. And also, I believe that Veterans for Peace need to support Medicare for all, or expanded services for all Americans, so that veterans and their families can get these services if they need them. And this will take the impetus away from trying to send veterans to the private sector by starving the VA budget and paying for it out of the VA budget. I want to thank you for having me talk, and I look forward to hearing your comments and questions.
All right, thank you, Suzanne. So next we have ESSAM ATTIA is going to talk about legislation that both positive and negative that affects the VA. So I will turn this over to ESSAM now.
Hey, Bruce, thank you so much. Thank you very much, Suzanne, for that amazing introduction. And thank you, Bruce, and VFP for having us here for this. I want to start by putting something in the chat for everybody. This is a link to a document that has a lot of links to research that backs up everything that Suzanne was talking about from the RAND Corporation and articles in New York Magazine, etc. But what I'm here to talk about is the legislative side of things, and really the nuts and bolts of how we're going to try to get this stuff done, right? So we're obviously fighting a pretty uphill battle here against the insurance industry and the Republicans in the Senate to try to stop this privatization effort and try to, you know, make the VA more robust for all of us. But how do we go about doing that, right? One of the things that we believe is really important at SOVA is like understanding like the legislation that is actually passing through the VA committees in the House and the Senate, and being able to mobilize our fellow veterans to you know, reach out to our representatives to tell them how we feel about some of this legislation. One of the things to note, and this is something that I've learned recently with some of my connections in the lobbying community, is that one of the reasons why there's such an overt attack on the VA and there isn't much pushback from the Democrats in the House and Senate is because, especially in the House, Nancy Pelosi uses the Veterans Affairs Committee kind of as a punishment for you know, representatives that she doesn't think, you know, deserve to be on, you know, like the more, you know, robust committees that are more, you know, sexy, for lack of a better term, like armed services and whatnot, right? So a lot of the Democrats that are in the Veterans Affairs Committee in the House, you know, like they don't really care one way or another, and so they're very keen and easy to get pushed along by the Republicans in the committee that are eager to like push a particular agenda, because, you know, they're getting their campaigns paid for by Blue Cross and Blue Shield. So what it's incumbent upon us really as constituents and as advocates to be reaching out to our representatives and letting them know how we feel. Now, what I'm going to do right now is go through a list just to give you an idea of what sort of war we are actually fighting right now, and what sort of legislation to be aware of that's on the table, and the things that you need to be reaching out to support and or oppose to sort of help move this, you know, like ship along, right? So we all know about the CHOICE Act, which passed, I think, under the George W. Bush administration, which was theoretically supposed to give us a little bit more choice in the doctors we chose. I actually wrote an op-ed about this where under that program, I ended up having to pay out of pocket for services that I got outside of the VA, because like the communication between the VA and the private sector was terrible. And, you know, like the integration was not there in the way that it is within the VA system. So like these acts obviously have problems. The Mission Act, of course, came along, which is much more recent. And it has its perks, but it also has a lot of issues because it too is pushing people away from the VA system. One of the big things that the Mission Act does, though, that is mandated, we're waiting basically for the Trump administration and Secretary Wilkie to appoint, is the creation of something called the AIR Commission, which is the Asset and Infrastructure Relief Commission. And this is obviously, like I said, created under the Mission Act. And it's supposed to start in 2020. I don't believe that commission has been appointed yet. Suzanne can maybe correct me if I'm wrong on that. But what that does is it begins the process to review and shut down VA facilities around the country that this commission believes, you know, are not meeting, you know, like the VA standard, right? And what it's going to do is it's going to lump VA facilities into groups, right? So if the commission goes out and decides that 5, 6, 7, or 8 different VA facilities are not meeting requirements and or are not doing a very good job, or are not, you know, serving a large enough community, right, and sucking up a lot of resources, they're going to put them on a list to be shut down, right? And when that list goes in front of Congress to vote, they're not going to be able to pick and choose off of that list. It's going to be an up and down vote for all of the VA facilities on that list, right? So that's going to be disproportionately affecting rural communities the most, because rural communities that have VA facilities, you know, they're not being utilized as much. So the underutilized VA facilities are the ones that are going to be undermined by this process. So we have a House Resolution 3083, which is sponsored by Phil Rowe of Tennessee, Republican of Tennessee, and that's he wants to accelerate the establishment of the Air Commission because he is one of the big proponents of privatization. And that's one of the big bills that has come out of the Mission Act that we're trying to push back against, so that we can buy some time before this Mission Act or before the Air Commission is instated and these facilities are shut down. Another really intense bill is Senate Bill 1943, which is the Parity in Veterans Healthcare Act. This is actually sponsored by a Democrat who we recently gave kudos to, but John Tester from Montana, and this forces the VA to pay ongoing care to veterans who are harmed by the private sector providers. So basically, if you are taken, you know, from the VA and sent to a private sector provider because it's a service that the VA doesn't have, and for whatever reason, for malpractice or whatever reason, you're injured as a result of that care. Maybe you're in physical therapy and you get hurt, right? Now the VA is actually supposed to pay for your ongoing care wherever that's happening in the VA or out of the VA, and the private sector provider that injured you is off the hook. Right, so this is just another way to drain the VA of resources so that it doesn't have the budget to do the things that it needs to do, right? And it has no provision to hold the private sector accountable for negligence or malpractice that results in these, you know, obviously preventable injuries, right? So these are two of the long list of bills that we don't like, right? We also have HR 2020. This is Congressman Takano, Democrat of California. And this is the Health and Suicide Prevention Bill, and also Senate Bill, its partner bill, Senate Bill 785, which just passed the Veterans Affairs Committee last week. And this is, there's co-sponsored by Tester as well, and also Jerry Moran, Republican of Kansas, and both of these bills outsource VHA funding for veteran mental health care to private sector providers. So one of the things that you're going to notice is on repeat here from the Mission Act to these two bills, and some of the ones upcoming, is a lot of this is done under the guise of like giving veterans more immediate access to mental health care, right? Which obviously like is a great you know, sentiment. You know, I would love quicker access to, especially when I was seeking a therapist, I would have loved that to have been a faster process. But the problem here is what's going on is it's basically shifting money from the VA's budget to the private sector, right? So what ends up, and there's a lot of manipulation going on in the way they talk about budgets as well, as far as this is concerned. So let's say the budget, you know, the VA has a budget of $50 million or whatever the budget is, you know, that's actually including money that the VA isn't allowed to spend internally and it has to spend externally, right? And so when the VA sends myself or yourself to a private sector provider for mental health or for anything else, you know, the VA ends up footing that bill. And of course, because it's a private sector, you know, the rates are much higher. You know, like, I don't know, for those of you in the room, how many of you paid attention to whatever war you may have participated in, the private sector contractors that were in country doing whatever they were doing, they were getting paid 10 times as much as their military equivalent, right? So like the private sector is basically coming along and using these government contracts as a means to like suck the taxpayer dry here. Another bill that we're not a big fan of is Senate 785. This is also a Tester and Takano bill. You know, Takano is really an interesting character because he claims to be on our side, but very often does not vote on like in favor of the veterans. This is called the Commander John Scott Thane Veteran Healthcare Improvement Act. And it also, again, is a further privatization of mental health care. This would pilot outsourcing of care to veterans and their families to private sector providers in the name of suicide prevention. Any veteran, regardless of VA eligibility and family member, could go to private sector providers delivering services of truly unknown quality for any period of time for open-ended services. And of course, you know, the VA would then be on the hook for paying for this, right, out of its budget. And Congress wants to care for veterans whose discharges, income, or lack of service connection makes them ineligible for VA care, which is actually, again, like just a further drain on VA resources, and ends up becoming a talking point for the Republicans to say that, like, the VA is not doing its job, it can't keep up with demand, it's spending so much money. But in fact, the way these bills are structured is to instigate that problem, right? HR 7469 is another terrible bill. Also, you know, under the guise of improving healthcare, it's the Modernizing Veterans Healthcare Eligibility Act. This is Phil Rowe, Republican from Maryland, and he wants to establish an advisory commission to basically re-qualify eligibility for healthcare, and basically turn the VA into a system that is only going to serve service-connected disabled veterans. So everybody else, you know, that doesn't have a service-connected disability rating is out the door, and doesn't even get to apply as like a, you know, under the current situation, there's like 8 priority ratings or whatever it is. And, you know, like, for instance, I'm priority 8 just because I'm an Iraq war veteran. And, you know, I still get to use the VA because I fit in that somehow, but under this bill, I would be kicked out the door. And then lastly, on our long list of, you know, very negative bills is Senate Bill 3235, which is the Veteran Post-Traumatic Growth Act. And this is sponsored by McSally, Republican of Arizona. This bill requires the Department of Veterans Affairs to conduct a 2-year pilot program to study the effectiveness of non-profit post-traumatic growth programs to determine the outcome of such programs in contrast to traditional models of mental health, the possible integration of such nonprofit programs into VA mental health programs, and budgetary impact of such programs. The issue here is, like, that all sounds good, but post-traumatic growth it's not a tested psychological, you know, medical process, right? Procedure, you know, so we don't actually have any idea if this is something that is going to be beneficial for veterans. It could actually be very harmful. This is really sort of like Wild West, kind of just slinging things at the wall and seeing what sticks here, and could actually be quite damaging for veterans that are seeking mental health. Now, in opposition to all of that sort of negativity that's kind of driving resources away from the VA and putting veterans in difficult positions, there are some pieces of legislation out there that are actually quite good, right? And these are the things that we need to try to support. Senate Bill S-853, which is by Senator Joe Manchin, Democrat of West Virginia, and Mike Rounds, Republican of South Dakota. This is actually in direct opposition to one of Phil Rowe's bills that I read off earlier, and this is the elimination of the Air Commission, right? And this is what they basically want to do. They recognize what the Air Commission is going to do is really disservice veterans living in rural communities. So they've created this bill to basically shut the Air Commission down, right? So, like, the Air Commission will never be created under the Mission Act. It will turn, you know, like, repeal that, right? Which would actually be an excellent move. So I think that is something that we need to look at and try to get our local representatives on board. HR 7504, which is the VA Clinical Training in Evidence-Based Treatments and Military Culture Act of 2020. This is by Lisa Blunt Rochester, Democrat of Delaware, to require the Secretary of Veterans Affairs to establish standards and requirements for non-department mental health care providers participating in Department of Veterans Affairs community care programs. This is a great act, right? So right now, there really aren't any standards for a private sector provider to jump in and get on the bandwagon of these government contracts serving veterans, right? So basically what this act is going to do is require the Department of Veterans Affairs to come up with a list of standards that private sector providers have to meet, right? And then, you know, not obviously, but if, for instance, this were passed, one of those bills that I read earlier, the McSally bill, the Post-Traumatic Growth Act bill, would most likely not meet, you know, the requirements of this act, and then would ideally not be able to happen. Another great bill that's on the table right now is HR 3224, Deborah Sampson Act, to provide increased access to the Department of Veterans Affairs for women, right? For medical care for women veterans. And this bill is basically entirely dedicated to issues of women veterans. So that's something that we as SOVA are greatly supporting. And then something else that's out there that serves, you know, like that can be a good negotiating tactic is HR 701, which is, you know, like a signing statement that people will fully, you know, support fully funding and staffing the VA. But it must be known that if you're going to go out there with that as part of your arsenal, like it doesn't actually tie any of these representatives to, you know, sort of an appropriation or an actual, you know, any actual change, right? It's really just a feel-good statement that could easily be ignored. So it can be a good negotiating tactic, but there's other legislation out there that is much more impactful. I am going to post right now in the chat a link to a document where you can review all of this yourself, and you can read up a little bit more and look up the legislation on your own to see how you feel about what's going on. But basically what I would urge people to do as part of this community is that we very much need to like let our voices be known as veterans. We have a lot of power as veterans. Representatives will take meetings with us and they will pay attention to our emails. We need to get out there. We need to take this document with us. We need to let our legislators know how we feel about this legislation. So please, fellow VFP members, Godspeed. Thank you for your time, and let's go out there and make some change together.
Thanks, ESSAM. And that was one of the questions we got. Could we see what the legislation is? So that'll be great to post it. Next, we have Dr. Foy, who's going to talk about national health care and potentially the VA's role in it. So I'll turn it over to him. Thanks.
Great. Thanks a lot, Bruce. It's a real honor to be able to speak to you all again. This is the second time. I was in Spokane last year and really enjoyed your meeting. I'll give you a little bit of background in terms of my military experience, which is limited to 11 months. As a kid from rural America out in the plains of Nebraska and a very modest means, the last of 5, I took an appointment at the U.S. Air Force Academy. And that was really my best option to get an education. My brother, who was recently returned from Vietnam and served in the 3rd Marine Division up on the DMZ, bathed in Agent Orange for 13 months, encouraged me to give it a try because I'd never know if I didn't personally experience the military. Well, I was singing an Air Force song one day, and the line of "Nothing could stop the U.S. Air Force" just hit me like a brick in the forehead. And I said, you know, by golly, they're right. And I resigned. I stuck it out for the whole year. I ended up doing well, which was fortunate because I could transfer my credits. But it took me a long time, and 20-some years of really haunting memories of that experience, to where I really realized what I was a conscientious objector. Again, my brother, who was not only a Marine infantryman for 2 years in 67, 68, but he also spent 26 years as a reservist total in both the Army as a helicopter paramedic, was deployed to the first Iraq War, and again deployed stateside for the Second Desert War. And he is a very vocal counselor in the VFW, as well as an advocate for a better world. Medically, you heard my background. I was as a general surgeon. I trained here in Seattle at the University of Washington system, which included time in the VA every single year of my residency program. And I also did a burn fellowship here, and then worked at what was left of the public health service for 5 years. And I went back to Harborview to work in the trauma center in 1991, where I stayed until my retirement just this last September. So I've had a really myriad of experience in a variety of different healthcare settings. During our residency, we worked at the VA, we worked at the University Hospital, we worked at Harborview, which is essentially an old county hospital, or what's left of them, and at private facilities as well. So I got to experience the whole thing, as well as the development of the electronic medical record, which at least in our community was started in our surgical department at Harborview. So I then got involved with Physicians for National Health program through one of my prior teachers and mentors, who was basically a yellow beret and a conscientious objector who took a position at the U.S. Public Health Service during the Vietnam War. And we helped fire up our local chapter, Physicians for National Health program, which had laid dormant for many years. And I've been very proud to be involved with that organization. And I'd encourage all of you to check our website out at PNHP. It's a national organization, and it's not limited to physicians. Anyone can be a member of that organization. Most of the chapters have monthly meetings, and its primary mission is education and advocacy to help us get a more sustainable and realistic and equitable healthcare delivery system in the US, which, as we all are painfully aware, is one of the last major developed countries who fails to have a national health program. Many would argue that the Affordable Care Act, passed now almost 10 years ago during the Obama administration, was truly just a bailout for the ailing and nearly failing US private health insurance industry. It was on the ropes. It needed a bailout, and essentially what it did, many of you might be aware, it took large risk pools, which is principle number one in insurance, and shattered them into tiny risk puddles. And anybody who's tried to negotiate acquiring care through the ACA or its websites realize that there are hundreds and hundreds, nearly thousands of different programs. And I don't know about you, but I can't even understand my medical bills, let alone go through the legalese that is involved in many of these. Innumerable programs that have high cost, or sometimes low cost, but then hidden are very high deductibles and co-payments, akin to all of the Medicare Advantage programs that are on there that we see on TV, so you can get your hearing aid and your other stuff, but then the coverage for a major hospitalization. I think one of the sentinel pieces of data that really helped impel me to continue work with PNHP is the famous bankruptcy studies done through the Harborview School of Public Health many years ago and repeated several times. It showed that people who file for bankruptcy in the US, when you go back and look at the records, the majority of them filed because of an inability to pay their medical bills. That's an astounding fact, but even worse is the fact that 76% of those who did go bankrupt had some type of healthcare coverage when they fell ill or were injured. So as the old deal goes, particularly in our system of employee-based health insurance, which of course now is horribly on the ropes, you lose your health, you lose your job, you lose your insurance, you go bankrupt, you lose your house, etc. So now in the pandemic, this whole fragile system, this for-profit medical industrial industry is now aghast and in the shadows, shuddering because of what the pandemic is going to do to it. And I think, before the pandemic, we had at least 25 million people that, despite the ACA, were and even more underinsured people. Now, with an additional 30 million people unemployed, that adds to that body of people who have no healthcare coverage. So there's an incredible boiling mass of people who have marginal coverage for healthcare, which they're not going to realize it's a problem until 3 months after their hospitalization and the bills start rolling and they realize how deep in debt and in trouble that they truly are. I appreciate ESSAM's discussion about the John Tester's bill out in Montana. Our medical school here in Seattle, prior to just a couple of years ago, is the only medical school for what we call the WWAMI region, which is Wyoming, Washington, Alaska, Montana, and Idaho. So for many years, I taught students and traveled throughout the WWAMI region. I grew up in Western Nebraska, so that I had kind of a homeboy attachment to it. In Montana and Wyoming, mental health care basically doesn't exist in any practical sense. Yeah, which is interesting to hear Tester trying to dump the VA's care onto the private sector. The private sector, I mean, if you need a psychiatrist in Montana or Wyoming, heaven help you, heaven help you. I had family members in the last several years who needed medical or mental health care in Seattle with top shelf commercial insurance. And I can tell you that was a thrash. The wait list to get in to see a psychiatrist in this city that has a very high doctor to patient ratio was 3 weeks. And in people who have mental health problems, if it has to degenerate to a police action, and good Lord, the last 3 months have shown us what that happens, particularly if you happen to have the wrong skin color. So the pandemic, I think, is really going to make this more difficult. Not only was elective surgery, which is the cash cow for our current system. I mean, I'm just recovering from a knee replacement, and that kind of stuff, elective surgery is what fuels the medical industrial complex in this country. Without that, they cannot survive. Acquisitions and mergers are in the paper every day, and all they do is improve the balance sheet of the failing community hospitals typically that get bought up. But studies have shown that the services to the patients suffer in almost every case of those mergers. And I can tell you testimonial after testimonial. Here we have a small rural unique area in the San Juan Islands here in Northwest Washington. My brother-in-law lives up there, and now my sister-in-law too. And they're craftspeople. They build houses, they're carpenters and everything. Well, they had a little clinic that worked really well in an old kind of country doctor model. Well, it got acquired by one of our big umbrella organizations, and their services have just plummeted. They can't get immunizations there, etc. Where in the old days, kid falls down, cuts his head. My nephew had cut his head on the beach. Doc came over, numbed him up, sewed him up right at the house. So these examples of needing acute care, people aren't seeking. Acute medical conditions like diabetes, people are not taking their insulin, not going to the doctor, not being monitored for their complications. Things like hypertension, cardiovascular disease, cancer screening, and then immunization. We don't have a system in this country to deploy immunization like we did back in the polio epidemic. When I was a kid, I remember going to the Cheyenne County State Fair. When I was about 8 years old, that would have been about 1961. And they filed us through a trailer, a semi-trailer, in which had an iron lung and a 14-year-old kid lying in there, talking to us through his reflector mirror overhead. And that was to encourage people to go get their kids immunized for polio. I can remember my mother saying, "No, you're not going to the swimming pool, Hugh. I know it's hot, but you cannot go to the swimming pool because of this polio epidemic." So now we've got something that on a scale is much, much greater. So, and now of course we've got warp speed search for the vaccine. My friends in the immunology and med tech business tell me that we will get a vaccine, but if you try to speed it up too fast and it's unreliable, it's even going to fuel the flames of the vaccine deniers, of which are among us everywhere. So how does single payer, or really improved Medicare for all, because like the VA, Medicare has been chipped away by the forces, the libertarian forces that have been alluded to before. Best book I ever read was Dark Money by Jane Mayer, that really documents well, and get one of the hard copies, because the diagrams on the inside cover tell the picture tells the story so well, and it was redacted in the paperback. But anyway, they've dismantled and chipped away with all these Medicare Advantage programs and all these other things. Set myself up for Medicare, for even me in the business, was horribly confusing. So how would Medicare for all or a single payer system dovetail with the VA? Will it threaten the VA? Is it compatible with the VA? And I'll just address those questions separately. I will say, will it get rid of it? No, I think the VA, as Suzanne mentioned, the VA is the best organized healthcare delivery system in our country. I mean, it is truly comprehensive. It's more like the United Kingdom system, right? Where it's not just an insurance program. It is, in fact, a complete, comprehensive 360-degree sphere of services and payment arrangements, and they employ all their docs, nurses, technicians, et cetera, and maintain their facilities. So it's very akin to the VA. So the VA has the advantages that nowhere else in the public system do we really have yet, although they're struggling to develop some at enormous cost, which is, first, the VA's networked. You can go into, as many of you know, you can go into a VA in Seattle when you're up here in the summer enjoying our 2 months of sunshine. And then when you go back to Arizona, few keystrokes, they pull up your medical record and they know everything that they need to know to help deliver most efficient care for you. So the electronic medical record that was developed as an open source project at the VA was the first, most comprehensive and best electronic medical record in the whole country. And the Secretary of Health and Human Services got up on the stage here and offered that to the medical community in this country, and they didn't take it because, of course, it took money to implement it, although the program would have been free. And now we're down to these huge corporations, as basically Ford and Chevy with two competitors. And one of the major contributors to the inflection of medical care costs in this country in the last 2.5 decades has been the implementation of an electronic medical record, which is very complicated, costs an enormous amount of money. An institution I know very well paid $10 million. It ended up taking $10 million to fully implement in 10 years. So this has been an incredible burden, and they're not really networked, and now we have two competing systems. So the VA's network. VA care is portable. You can go anywhere. And the other thing that the VA has is a very robust education and research infrastructure. They do an enormous amount of research. They have scientists at the VA, and they have large databases to track populations with certain diseases. And that's going to be critical as we go through this pandemic, to really track well, not just positive tests, which aren't, have a problem with accuracy as well, but also antibody presence and levels for people, and then see if they get the disease again. Is this going to be like a cold where you get one and it goes away? Or is this going to be like herpes or chickenpox, which can come back and haunt you later with shingles and other diseases where the virus is harbored in your body? We don't know yet. Improved Medicare for all and a single payer is really just an insurance mechanism like Canada to help streamline the billing process, which now takes over 31% of every healthcare dollar. 15%, which is just profit off the top to pay insurance companies, and then another 15% or so for facilities to develop the armies of people to have to deal with these thousands of different complicated medical plans. So the other thing I think, well, we need the VA, is that VA serves a unique population that have unique needs. And, you know, Suzanne has gone through those, and I would highly recommend her book. It's excellent. The whole idea of PTSD, the whole situation with Agent Orange. My brother's got, out of his 4 kids, 2 of them have uncharacterized autoimmune disorders. I wonder if it wasn't that 13 months he was bathed in that dirt bunker there overlooking the DMZ. So you're a unique population. You need a unique, comprehensive, and you have a unique, comprehensive medical care system. We shouldn't get rid of the VA, just like we shouldn't get rid of children's hospitals. We shouldn't get rid of trauma centers, you know, and we shouldn't get rid of the really very specialized cancer centers as well. So as we reconsider the road ahead now in the midst of this pandemic, and I don't think we've seen a fraction of the impact it's going to have on us, not only medically, but financially, personally, etc. We need to, as our medical industrial complex collapses, we need a system to rebuild ourselves. And I think the VA provides the best model for an organized, comprehensive, universal access. You know, everyone in, no one out. Again, I want to thank you all.
I don't want to cut you short here, but we still have one more presentation and a Q&A.
Well
We
done.
want a little short of time. So I really
Well done,
appreciate
Bruce.
your presentation. And if there are questions, you can post them. We'll try to answer them in the Q&A section. Next is Jeff Roy, who will talk about the Outreach Committee. Thanks again, Dr. Floyd.
You're welcome.
Thank you, Bruce.
Jeff, go ahead.
Yeah, you can hear me and see me. Okay, good. I just want to say that after all that you've just heard, how do we accomplish the goals of saving the VA from privatization? And so that it's fully funded and fully staffed, as Suzanne was saying, and so that high quality VA healthcare is accessible to rural veterans, as Dr. Foy was saying, and so that the VA continues its work making VA healthcare more respectful and effective for all veterans, regardless of gender and ethnicity. Well, we can't do it simply with the current membership that we have now, the 135 activists in the Save Our VA National Campaign. It's a lot of people, but it's not enough. We must mobilize many more activists, including all potential allies. And Dr. Foy was mentioning an ally like PNHP, and here in Minnesota, Healthcare for All, as one of those potential allies. But again, we need to reach out to these allies who in some way have skin in the game. VFP members, of course, veterans using the VA workers unions, and the broader union movement. And of course, Healthcare for All organizations that see the VA as a model for future universal healthcare. This mobilization, though, requires an organized, long-term, and protracted effort to contact and recruit VFP members and all of these potential allies across the nation. In doing so, we must not only recruit new SOVA members to the National Save Our VA Coalition, but also provide them with the technical resources to support their organizing efforts to expand local SOVA activities that add to the national movement. To accomplish this mission, the SOVA Outreach Subcommittee that I'm a member of has already been working diligently in recent months. Some of those actions successfully done this year are the following. We sent a recruitment letter to all VFP members who attended our successful February 2019 Washington, D.C. lobbying conference and asked them to stay active by joining one of our national SOVA subcommittees. We sent a request to all VFP chapters asking them to provide our campaign with contact information on any local SOVA activists from the past few years, because this has been going on for a number of years. We developed a digital survey tool to elicit information from interested VFP individual activists. We contacted activists from old SOVA contact lists compiled since at least 2014 to determine their interest and the level of activity they would volunteer for. That calling resulted in 135 or so interested SOVA volunteers nationwide and identified several already established chapter SOVA committees. We drafted an email sent out by our national executive director, Garrett, to the entire VFP mailing list, which produced 14 new SOVA activists. And we sent several SOVA action alerts and form letters to our activists, asking them to send personalized letters to their congressional members, asking them to either support or oppose specific veteran legislation, as ESSAM was talking about. We drafted and distributed through the VFP e-News several Save Our VA campaign articles, updating and explaining what the campaign is all about and encouraging VFP members to get involved. And finally, we have encouraged periodic informational picketing actions at VA medical centers and clinics. Some chapters have been picketing for years. But so much more is needed to be done, and we need your help. We ask all VFP members listening to us to get involved today. You don't have to live and breathe SOVA, but there are many ways that you can help. You could be a SOVA contact point person for your own chapter if you don't already have a local SOVA committee. Or you could start a SOVA committee if your chapter doesn't have one. You can start or participate in a regular local SOVA informational picketing action near your local VA hospital or clinic. You could join one of our national subcommittees where we really can use additional energy, ideas, and those subcommittees are outreach, events, legislation and lobbying, education and media, and fundraising. You could write letters also regularly to your congressional representatives and senators, either on your own or when we send out form letters calling for support or opposition to legislation, letters that you can personalize. You could reach out to your union to pass a SOVA support resolution that we can provide. Already we have here in Minnesota, we have unions that have done such, and that of course helps us to reach out to a very potent ally. The important thing is that if you want high quality VA healthcare to survive, please get involved. And you can contact us. I believe that ESSAM will put something out here in terms of email addresses that you can send that you can contact us through in order to find out more about the SOVA campaign and to get involved. I want to thank you very much. I want to thank Suzanne for a great presentation, ESSAM as well, and Dr. Foy. And that's it for me.
Thank you very much, Jeff. We're going to have a question and answer period in just a minute here. I wanted to say just a word or two before we start that. I mentioned I was a career VA employee. I worked in 10 different facilities in the VA in almost every part of the country except for the Southwest, and that included a stint in central office for 3 years. And I know that the VA is a large organization and has its problems, but my experience with the VA and with people I've known who use the VA is that it provides first class health care for veterans. It takes care of their families, and it is full of employees who are dedicated to the mission of the VA. It is the one organization that is committed to veterans, the one organization that will track ailments that we experience from things like exposure to Agent Orange, burn pits, other problems that are associated with military service. If the VA disappears as an organization, as an integrated organization, veterans will not be taken care of. They won't be tracked. We won't know what happens to them. We'll have no idea over the coming years what will be the effects of traumatic brain injuries and exposure to burn pits for Middle East veterans. The only organization that will be committed to that and will track that information and do the necessary research will be the VA. So it's important to all of us as part of the veterans community to get involved in this effort. There are many things you can do that don't require that much time, but you can really help us save the VA, and not only save it, but strengthen the VA and make it a part of national health care. I'm going to do the question and answer section now, and I will try to direct these questions to the appropriate person. So if everybody on the panel could open up their mics, at least you could hear what the questions are, and then I'll start on, we have a number of them here, and I'll try to go through, try to summarize some of them. One that came in was, how can people know what their representative's position is? How can they know whether a representative is supportive of the VA or not supportive, so they know how to respond to this person or write to them? Is there a way they can find out, a list or some sort of online area they can determine this? Anybody who can answer this question would be fine.
Suzanne, you can look at who voted for the Mission Act, the VA Accountability Act, and then otherwise, unless ESSAM or somebody else knows something I don't, you just have to contact their office with asking them and telling them what you want supported or opposed. I mean, there are lists of how folks voted on the legislation that is very pernicious, like the Mission Act, the VA Accountability Act, and so forth.
Yeah, let me just say, what I think can happen if you just contact your representative and say, do you support the VA? They will say yes. You need to ask them about specific legislation. How do you feel about privatization? How do you support this legislation? Then you'll get a feel for whether they really support the VA or not.
Could I just add something, Bruce? It's
Sure.
very important not to ask how they feel about privatization, because Robert Wilkie will say he's against, the Secretary of the VA will say he's against privatization. So will Phil Rowe, so will Jerry Moran. I think you have to get really specific, which is one of the reasons why we're not so enthusiastic, even though Ethan mentioned it, about House Resolution 701, because they all define, you know, most of these representatives, Democrat and Republican alike, define privatization as tomorrow we're shutting down the VA, renting out all its facilities, laying off all its staff, and selling off all its equipment. And that is not, privatization is a spectrum from that to what they're doing, which is the salami strategy where you death by 1,000 cuts. So I would say, when you talk to a political representative, don't ask them if they're, sorry, Bruce, don't ask them if they're for or against privatization. Ask them very specifically, what are you going to do to fund and staff the VA? What are you going to do about this bill or that bill or whatever?
Thanks, Suzanne. I think that's good advice. You're right. You don't want to ask just a general question. Did anybody else want to comment on that? Another question we have that came in is, during the pandemic, has the VA stopped referring patients to private providers?
probably I should take that one.
Go ahead,
Um,
Suzanne.
The VA, just to protect patients and staff, has stopped referring out under the Mission Act. The Concerned Veterans for America, the right-wing group founded by the Koch brothers and funded by the Koch brothers, has objected to that because they're terribly afraid that this will stop privatization. And one of the things that we all did, and Jeff, you might want to speak to this, was send out an alert because the CVA sent out an alert asking veterans to send letters to the VA objecting to the cessation of referrals to the private sector. And maybe, Jeff, you could say something about what we did.
You have to unmute, Jeff. Jeff, you're on mute. There you
Okay,
go.
yes. I can't speak exactly to what you're saying, Suzanne. Say it again.
So we sent out an alert asking veterans to write letters to their representatives saying that it was appropriate to stop referrals to the private sector under because of the COVID pandemic. And, you have a private sector system at the state of collapse where they're asking to send, veterans to VA hospitals. Doesn't make any sense to be sending veterans to hospitals and providers that can't handle their own civilian sector patients.
Right, and that is one of the important roles that the SOVA campaign can play and has played, and that is to alert people periodically to such things, either nonsensical things as referring veterans to private care, but also any other kinds of issues that come up legislative-wise in terms of things that will either hurt the VA in the future, current or in the future, or help the VA. So another reason why really encourage people to be in contact with us so that you can get that information, the action alerts from us, and so you can help join this national effort.
Thanks, Jeff. Next question that came up is a question about the SOVA website. Somebody said there doesn't appear to be a SOVA website. Are we going to have one? Can we give people a link to the SOVA website? And maybe ESSAM could field that question.
At the moment, there's just a slightly out-of-date page on the VFP website. So there is some information on SOVA on VFP's website. I can send a link to that in the chat in a couple seconds here. But note it's a bit out of date. We're working on that. There's been internal things going on as we build this movement. So stay tuned.
And let me say, Jeff talked about us needing help. If somebody out there is familiar with this kind of work and would like to help the steering committee do this, we can appreciate it. There are essentially 6 of us who have been working on this, and we can use some additional assistance. We need your help at the local level, but if you're interested in being involved nationally, you can contact us and we could use your assistance. It's been a lot of work for the 6 people. So another question or an issue that has been raised that came up is comparing VA healthcare to the private sector healthcare. And I think there are a number of studies that show that VA healthcare is at least comparable to private healthcare and often exceeds that. It would be helpful if people could have links to these studies. So if they have a conversation with somebody else or they're writing to their congressional delegation, they can say that all these claims about VA healthcare are in fact not true. And there have been independent organizations, respected organizations that have studied this and have found that the VA is equal to or superior to private sector, both in terms of quality care and waiting times. And I think, ESSAM, we have a link we can send to people with that, don't we? Or we can post?
I put it in the chat a couple of times.
And
Okay, so yes. So let me go on just a sec. So take a look at that and you can look at those studies. They're valuable information and talking to your friends and neighbors, congressional delegations to show that in fact the VA, despite what we hear in the press, the VA provides very high quality health care. Sorry, go ahead, Suzanne.
Yeah, I would recommend that everybody on this call and who's interested log in, and maybe ESSAM, you could help with this. I'm not very good at this chat thing. You might want to log into the veteranspolicy.org, the Veterans Healthcare Policy Institute, and subscribe to their newsletter and check out the website, because we have all these studies listed. They come out regularly. And, you know, I'm sort of working with VFP from the HPI on this. So that's where you could really keep up to date. There was just another one in JAMA that evaluated the failings of the Mission Act. So that's, again, veteranspolicy.org. ESSAM?
It's in the chat.
Okay, great. Thank you so much.
Thanks, ESSAM. So there's a lot of valuable information in the chat. Another question that came up that Suzanne did address earlier, and I think is of interest to a lot of people, is what services can veterans' family members receive from the VA?
Well, that's why we want to expand it. Right now, not very many. This is really a problem. That's why I particularly, and many people are in favor of expanding to family members, which would also help with underutilized VAs. There's certain vet centers can sometimes, I think, deal with family members. If the veterans can get family therapy, if the veterans' family's dependence problems impact the veteran. But, you know, it's very limited and it really doesn't make any sense. And that's why these bills like 785 are really bad, because, you know, they're allowing family members to go to the private sector to get care. Why don't they open the VA to family members? And I think that should be a demand.
Thanks, Suzanne. Another question we have is for Dr. Foy, and it wants to know, how would the VA healthcare system be integrated with a national healthcare plan?
Well, again, that depends on what a national healthcare plan rolls out to be. The current proposals are just for a payer mechanism. So the nuts and bolts of that haven't been worked out, but one could imagine that there would be some cost shifting from different budgets, where the federal government, once they fund the national health plan, might be able to give the VA. It's just really a streamlined insurance program. So like Canada, you have a national health service card. You can go to any provider and you get your services. Now for a veteran, one of the downsides is, well, I don't need to go to the VA. I can go anywhere. So I don't have specific issues where I need to go to the VA. I'll go someplace closer to home or whatever. I think for people who have comprehensive needs, though, it, you know, gee, I saw a white-haired retired colonel sitting in a bed in a VA one day, and that flew 800 miles. But he did that because he could get better, more comprehensive care for his lymphoma that he could get in his own community. So I think the details of that are still to be worked out, but I don't think they should be seen as incompatible.
Thanks, Dr. Foy. Let me just say from my own experience when I worked in the VA in central office, the VA got authority at one of its Southeastern medical centers to treat all veterans if they who had Medicare, and the VA would charge Medicare rates without co-pays or deductibles, and that hospital actually made money on it. It actually ended up, its budget was better as a result of doing that. But when the VA asked Congress for authority to extend that experiment, it was shut down because the medical industry in this country is so strong, it can do that. I'll give one other example. The VA got authority to purchase drugs on a national basis, which saved millions and millions of dollars. Medicare has asked for that on more than one occasion, and Congress has shut that down because the pharmacy industry is so powerful. They know that the savings would be tremendous for Medicare patients, but would cost the pharmacy industry a lot of money. So I think personally, if we talk about a national healthcare system, the VA could be a part of that, and it could provide services for all veterans, and it could take the insurance reimbursement like it does now. All people are on Medicare or Medicaid. It wouldn't have to charge co-pays or deductibles, and it could be a part of that. And if we talk about Suzanne's proposal that family members could be treated, we're talking about maybe 20 to 25% of the population who might be treated by the VA. So it could be a significant part of any sort of healthcare plan.
Mm-hmm.
Another question we had was, what do the people on the panel think is the most important thing that people can do, that if they have limited time and limited access, what would be the one thing they can do that will help to save the VA effort?
Vote.
Maybe Jeff or anybody who wants to field that question, that's fine.
Yeah, I would just chime in. I would say, number one, make sure you're registered to vote, and vote. Number two, you know, one of the ways you vote unofficially in this country these days is by calling your Congress member. Okay, all you need to know is your area code for Washington, D.C., which is 202. You can call 202-555-1212, which is information saying, may I have the office of, you know, Representative Pramila Jayapal, who's from my community, and they'll get you right to their office. Or if you go online, you can get all of those numbers. And when you have an issue or a question, or you want to make a statement, call them directly. You're probably going to talk to a staffer. They'll make a check mark next to the issue. It helps if you know and have a specific issue or a specific bill number, but call and call often. The majority of us have free long distance now with our cell phones, and it's a very effective mechanism.
Anyone else want to chip in?
I think that one of the biggest things Veterans for Peace members can do is counter the effort to organize veterans against progressive reform like Medicare for All. Right now, the CVAs, Concerned Veterans for America, Robert Wilkie, they've all trying to organize veterans against Medicare for All with this lie that it's going to hurt the VA. And you can talk to veterans about this. Another thing that I think is very effective is, and we've done a lot of, is every chapter could have a meeting, a Zoom meeting on, which is very simple to organize. On this issue, we invite people from SOVA. We've done a number of these, and that's a very good way to get people involved. And also you can invite central labor councils, you can invite Healthcare for All, PNHP, various other members. And so just take, you know, if you just committed to making one call a month, which takes literally 5 minutes, to talk, you know, to say, I'm for this, call your representatives and say, I'm for this, I'm for that, and then committed to writing, you know, having a meeting or doing something once a year. I mean, that would be very big.
Let me just briefly tell you something we did in our chapter in Asheville. We have a local SOVA committee, and we met with the Democratic candidates for Mark Meadows' seat. I think if you know Mark Meadows, he resigned to be the chief of staff for President Trump. And by doing that and showing him statistics on how many people were in the VA, we got all the candidates to put on their website a position against privatizing the VA. And the person who won the primary, Mo Davis, who's a retired lieutenant colonel, has been very strong on opposing privatization. So that's something you can do. I think you can contact them. And in terms of letters that we send out, almost all congressional delegations now use email. You can go to their site and it'll say, contact me. You can take the letters we send out, modify them slightly, and send them. And the whole process probably doesn't take any more than 5 minutes. And then the last point is, most congressional staffs have a person on their staff who's concerned with Veterans Affairs. So try to get to know that person, try to establish some kind of rapport with them by calling them and talking to them about your issues, and they'll know who you are, and they'll know the issues that you're talking about rather than just talking about any staffer. So always ask for the person who's involved with the Veterans Affairs. We have another question that came in. or I guess maybe sort of a request for us to say that if you're having, your chapter's having a Zoom meeting and you would like somebody from the steering committee to participate in that Zoom meeting, one of us would be happy to do that. If you want us just to talk for a few minutes, you can contact us and we'll get in touch with you. And I think we're getting close to the time, but give me 1 minute to look at a few more questions and see if there's anything else we can answer.
We'll have to wrap it up pretty soon. Sorry,
Okay.
everyone. I have to switch Zoom accounts and start the next thing. So there's folks waiting on me.
Okay, well, I think we've answered the questions. There were a few people who said that they had a little trouble looking at the document that on legislative, on bills that ESSAM posted. So I don't know, they couldn't open the PDF or not. ESSAM, do you have a solution for that or a way they can get to it?
I'm actually not sure what the issue is because I've opened the link and I've seen like 10 or 12 people looking at it. So I think the issue might be on that person's end. I apologize.
Okay. Well, I think as Garrett said, that's all the time we have. And we really thank all the participants. We hope that this has been informative, and we hope that you will become involved in SOVA at the local or at the national level. There are a lot of things you can do. Many of them won't take that much time, but will really help our cause. So on behalf of the SOVA Steering Committee and the participants on this call, we appreciate your time and your attention, and we hope to hear from you. Anybody else want to say anything? All right, well, I guess we'll thank the panel, especially for the people who've given their time for this SOVA presentation. All right, thank all of you. Bye now.
Thank you guys. Take care.
Thank you.
Thank you.